member for Athabasca Sturgeon Redwater.
Thank you, Mr. Speaker. Mr. Speaker, for too many years, the healthcare concerns of rural Albertans have gone unheard. Albertans want to ensure that our government will invest not just in healthcare in our cities, but ensure access to services are strengthened and protected in rural communities too. How is the Minister of Health, after hearing concerns of rural Albertans, going to provide quality healthcare close to their homes?
Minister of Health.
Thank you, Mr. Speaker, for the important question. Our government is absolutely committed to protecting health care for all Albertans, no matter where they live. And that's why, immediately after being elected, we cancelled cuts that were proposed by the outgoing government and refused to move forward on cuts that were proposed by the official opposition. We think it's important to work on listening to rural Albertans. That's why during the constituency breaks, I toured communities like St. Paul, Bonnyville, Lac La Biche, Fort Vermilion, Vegreville, High Level, Olds. We're out on the front lines getting opportunities to meet with rural Albertans and to thank the public service for their
Honourable Minister.
Thank you, Mr. Speaker. Given that the Minister has been on tour and given that there is a need for quality care in rural Alberta, will the Minister highlight some rural health initiatives that will have positive impacts? And can she discuss any local programs that are working from the bottom up?
Minister of Health.
Thank you very much to the member for the question. Certainly there are a few announcements we did and opportunities we had to tour during the break. One excellent example is the dialysis unit that will be permanently integrated in Lac La Biche. I'm also really proud of some of the work happening in the Lakeland Regional Healthcare Initiative, where communities are working collaboratively, as well as high levels, doing excellent work around mental health. And in terms of having an opportunity to be involved at the local level, Alberta Health Services launched just last week a recruitment initiative for 70 public members to the Health Advisory Councils, Mr. Speaker.
Second supplemental.
Okay, thank you, Mr. Speaker. Mr. Speaker, given that the opposition parties are calling for significant cuts in health spending, and given that we need to ensure that rural Albertans have access to those professionals and the physical health infrastructure, equipment and facilities to deliver quality care, can the Minister outline her approach to ensuring that this happens?
Minister of Health.
The member is right that opposition cuts would lend to rural hospitals closing and rural nurses and other health professionals being available for Albertans where Albertans need them most. On my most recent trip, of course, Lac La Biche received an announcement of their much-needed dialysis unit. These are the kinds of things that we're moving forward on because this government, this side of the House, voted for a budget that has new money in the infrastructure maintenance plan, and will continue to move forward on making sure that Albertans get the care where they need it, Mr. Speaker.
Honourable member for Cardston.